Preoperative nursing is the first step a patient will take before their operation begins. It involves assessing a patient's physical, psychological, and social states, all while preparing them for surgery. To start, a preoperative nurse would gather a patient's history and physical. A patient can give this information at a doctor's office, hospital pre-admission area, an inpatient unit, an outpatient surgery facility, or on the phone. The next thing a preoperative nurse would do is identify a patient's support group. This could include a significant other, family, friends, or the patient's family and education. The next thing the nurse would gather is a preoperative checklist from the patient. This includes: do they have a gown? Has all their jewelry been removed? The patient's personal belongings, and making sure that they are identified and secured. A confirmed name, a date of birth. To confirm that consent forms are completed, an X-ray, lab results, and EKG are on the chart. They would also verify if an implant was needed, or verify the availability of blood. And then lastly, a preoperative nurse would do something called the universal protocol. This involves making sure that they even have the correct patient that had signed up for this procedure, and to double and triple check that this is the correct surgical site for the procedure about to be done.
The intraoperative phase begins when a patient gets admitted into an operating room. From there, they begin to apply the anesthesia, and once the anesthesia fully kicks in, that's when the surgical procedure begins. And when the surgical process is finished, the final stage of the intraoperative phase is when the patient gets transported into a recovery room and begins the post-anesthesia process. The surgical team. First, the surgeon. The main role of the surgeon is to safely and effectively perform the surgical procedure. They are basically the leader of the team. The anesthetist. The main role for the anesthetist is to safely induce the anesthesia into the patient and make sure that nothing goes wrong in order to prevent the patient from feeling any pain. Another thing the anesthetist is responsible for is the physical relaxation of the patient's body for the entirety of the surgical procedure. They are to make sure they keep an eye on the patient's oxygen exchange, systemic circulation, neurologic status, and vital signs. The scrub nurse. Scrub nurse is responsible for the surgical setup of the surgery. They also assist in the handling of tools and the direct assistance to the surgeon. Circulating nurse. The main role of the circulating nurse is to assist in any questions or requests that the surgeon, anesthetist, or the scrub nurse may have. For example, they are to deliver any needed tools or supplies that is needed. They are also responsible for carrying out the nursing care plan.
Post-operative nurses are responsible for monitoring and ensuring quality health care for a patient following surgery. This includes watching the patient's vitals, providing good wound care, administering medication, and helping with rehabilitation if needed. Keeping the environment sterile to prevent infection is very important. Another thing to keep in mind is to use layman's terms with the patient. Most likely, the patient will not understand medical terms, so the nurse needs to make sure that the patient completely understands the procedure that took place and what the aftercare instructions are. If the patient does not understand the instructions, there could be complications, such as the wound could get infected, the patient may overdose on a medication if not following the instructions, or the wound could even open back up. The first 24 hours after surgery involves monitoring patients coming out of anesthesia. This involves watching their vitals, keeping pain management under control, informing the patient's family of their outcomes, discussing an aftercare plan for the patient, and what to look for if something goes wrong from their baseline. If something does end up going wrong, then they need to report back in to be reevaluated.
You saw this patient, you bring them into the OR, you fix them, and you take them to recovery. I always like the immediate gratification of seeing somebody get better.
We do assessments, we do documentation, we administer medications, we do everything that all nurses do. We just have to do it in a very short amount of time.
I think the best part of my job is being able to be someone's lifeline. They're absolutely terrified prior to surgery, and being able to be that someone's everything, it just takes your breath away every time.
I've been an orthopedic surgeon for 20 years. Surgery is such a team sport. It's impossible for the team and therefore for the surgeon to be successful without having outstanding operating room nurse and circulating nurse.
They are that advocate, they're that healer, they're the educator. We really want nurses to explore a career in OR nursing because really the possibilities are endless.
That's one of the great things about Cleveland Clinic. You can be a circulating nurse one day and scrubbing in the afternoon. There's never any set pattern.
When you're circulating that day, you're trying to keep this room together, keep it on time, looking ahead to your next cases. You're running the show.
I really think that just being able to understand that you are part of a team and can be any part you want to be.
I came here to Cleveland Clinic. I said, I have no experience, and they said, that's fine. We have a perioperative program where we train you.
The orientation process in the OR is a full 6 months minimum. The first few weeks you are going through classrooms and learning the basic instruments, and then after that they actually get you right hands-on into the OR.
In the simulation OR, they have what you see in a real OR. It's the lights, the bedding, the equipment, learning just a simple gown and glove using a scrub scene.
The education team that actually guides us through our entire 6-month orientation really fights for you and makes sure that you learn everything.
They want you to be the best nurse possible here.
It's about integrity, it's about compassion, it's about innovation, it's about quality, and probably the most important value is teamwork. And for a nurse to live those values at the Cleveland Clinic really is the foundation for success of being an operating room nurse.
You can specialize in general surgery, or if you want to get more specific, like cardiothoracic or open heart surgery, we have a track for you. So from basic surgical procedures to doing face transplant, the opportunities are endless for an OR nurse here at the Cleveland Clinic.
I am the last calming force for the family and the patient before they roll into that OR. You're there to say, it's okay, I do this every day, and we're going to take the best care of you.
We take care of the sickest of the sick on patients from all over the country, all over the world. You learn so much and you have the power to change so many lives.
We have the finest staff in the country and in the world. We do the cases that no other hospital will touch. It's a very impressive, very humbling experience to work here with this caliber of people. And I think personally, I wouldn't want to be anywhere else.